My name's Gershon Kutsi and you're watching Mellow TV. Have you ever injured yourself during sport and perhaps require knee surgery or knee replacement? Or perhaps you've hurt your back and it has affected your mobility, or you've been an adventure seeker and perhaps fell off your bike. Well, should you require the assistance of an orthopedic surgeon, we now introduce you to resident orthopedic surgeon at Malamet Tokai, Dr. Atwaru.
I'm Resham Atwaru. I'm an orthopedic surgeon. I do spine surgery. Originally from KwaZulu-Natal, and I joined Malamet in 2016, June. Hospital was still pretty young then. I did my undergraduate training at Natal University in KwaZulu-Natal, and my internship and community service was also there. I have worked overseas for a year to acquire training in orthopedics, and my postgraduate training was conducted in the Durban complex. I've been in private practice since 2008, and I've serviced quite a large area in KwaZulu-Natal, including the northern part, the north coast. I've also been involved in the Flying Doctors program. It's an outreach program in association with AMS, where we provide specialist healthcare to rural communities in the north of KwaZulu-Natal.
Just listening to you right now, you have a real love for what you do.
Yes, I have to concur with that. Whenever anyone asks me about orthopedics, I simply explain it. It's all the fun stuff combined in one. It's almost like carpentry, plumbing, but done in a very controlled environment, in a very specific way. And it's very enjoyable, and the results bear out in happy patients.
Talking about patients, you specialize in spine. Now, that can be an array of things, from a bad bed to bad posture, or being injured.
Yes, Gershon, surprisingly, lower back problems are extremely common, and they will affect us all at some point in our lives. There are several things that we can do to preempt this problem, and they're very simple. And it all boils down to education, exercise, and keeping a healthy spine to prevent spinal problems in future.
How do you keep a healthy spine?
Surprisingly, I advise all my patients that the best exercise is walking. To maintain a healthy core, including your abdominal muscles and your back muscles, is one of the best ways to avoid future spine problems. So it is something that we're all equipped to do. It's a cheap form of exercise, and we do it anyway. It's just that we need to structure it.
If you look at your job itself, you see patients from an array age. What is the most common age that you see to? The vast majority are middle-aged patients in their 50s, between 50s and 60s. This is when the spine problems start rearing their heads. Generally, the younger patients that do complain of spinal issues they usually run a benign course. They would present to the back problem, and in about 85% of the time, it would resolve. Most back problems, one wouldn't be able to find an abnormality